I have just forgotten to ask Dr. Kazan. I've spoken to Dr. Paul, the previous consultant, who said that he was going to request a referral and a review from a urogynecologist or gynecologist specialist because there's a couple of indications that I have a vaginal infection. But I didn't hear anything from him about that right now. If the urogynecologist specialist had come back to him, because I've had it informed to me by several clinicians via email that it's very important that urogynecology have an input, because this is not just a urological infection, this is a urogynecological infection, and it's also related to things like childbirth and obstetrics. So
you
that's
want to see the doctor.
Well, yeah, ideally if he could come back and speak to me. I know he's just in the corridor because I need to ask about the referral to urogyne and what's happening with that, because that wouldn't be a wait for an MRI. That's quite easy.
So what's the name of the doctor you just saw?
Dr. Kazan, yeah. So I've just heard back from YE, this women's health company who do home testing. Victoria has advised me that I ask here for some input or a review or referral from a urogynecologist or gynecologist to inform the treatment plan. Dr. Paul spoke to me about this, I think it was yesterday, and then I've just asked a nurse to ask Dr. Kazan about whether they're going to come and give me their clinical opinion, because I think that would sort of change a lot. But yes, I'm just waiting to hear back about that. Because I'm under urogynecology, which is the appointment I had before I came here, but I'm under pelvic floor rather than, immunology within that department. So I'm just waiting to hear about the on-site urogynecologist and whether they can have a discussion with the urologist to work out which would be the best antibiotics to hopefully treat the whole of the pelvic infection rather than it just being a urological antibiotic, which might not target the root cause of the problem. So I'm just going to wait and see if the nurse comes back to tell me if she's got an update from Dr. Kazan about that.
And we do have like a doctor that works with urology. She says she's happy to get customers as well, and then she can contact them with that message as well.
This has been in the freezer overnight, so I'm just going to have it on. So it looks a bit.
So what you wanting to know is
I don't know about I want to eat this. It
I
looks a
know
bit.
it's
It's got some weird stuff on it. I don't know if I left it out for too long yesterday. I don't really want to risk it, to be honest. Cold. I'll probably be fine. I need the protein.
How did you have it changed? Right, I'll let her know, and then what she'll do is she'll pass it through to the team that will round tomorrow, and they'll have to just get back to us and let them know.
So this is in
I'll
Martha's
just let her know
Vets, this
that
egg
that's what it
mayonnaise
is.
sandwich. Which is great.
Hello.
Oh, hi.
It's not yet done.
Yeah.
It's going to come in freezer. But I get a doctor that's in a different trust.
So basically, Dr. Paul, who's the doctor who was my consultant before Dr. Kazan stepped in today, he's received an email from Nick Parkinson, who's the scientific director, which states that the origination of this infection is most likely gynecological and related to childbirth, like, because I had a vacuum delivery and I had an episiotomy, so it's likely the infection started gynecologically, and so he's recommended I receive metronidazole for that, but I've already had metronidazole. But what Dr. Paul said yesterday and the day before was that he was going to request for the on-site urogynecologist or gynecologist to review and give their clinical opinion, because this is not localized to a urological infection. This is a urogynecological infection. It's a pelvic infection, so it affects multiple different regions. And I've also been recommended that approach by Victoria from a women's health company as well. So there's multiple clinicians who have said it's very much a good idea for urogynecology to get involved, or gynecology to get involved, because in light of the fact I had this adverse reaction to the pivmecellin, if they're going to prescribe a new antibiotic, they may as well make sure it's one or a combination of antibiotics that's going to target the whole infection. Because if they just target the infection in the urothelium, then they're not going to get the infection that's gynecological, because that's in a separate part of the body. It needs separate drugs because it reacts separately. That bacteria operates separately in different areas of the pelvis. So that's why I just wanted the nurse to ask Dr. Kazan, A, have urogynecology or gynecology been sent the referral? B, have they come back to us? Have they already given their clinical opinion? Are they going to come and consult with us? Are they going to inform the treatment plan? Because I think everyone wants me to be discharged, but whilst I've still got an active infection, that's why I'm here.
Yeah, I told her about an email, but we can't give our emails out.
No, it has nothing to do with an email. This has got nothing to do with an email. This is to do with
You want to
multiple
know-
clinicians asking for urogynecology and gynecology to give their clinical
I'll have
opinion
a
and
look
review.
on the system and see if it's right.
Yeah. Okay, thank you. So they don't want to give me the email. But I've already sent to the secretary for Dr. Hazan
Um, the email from DAYE Women's Company of Victoria saying I should ask for a review from a gynae or gynae specialist in the hospital on site. She said that's extremely important to review and give clinical opinion. And then also Nick Parkinson, who's the scientific director from Digital Microbiology, said that he thought that this was a gynecological issue and that I needed to be given treatment for that. So that's also why that's the second clinician who said I should ask for Urogynae or Gynae to give their input. So yeah, I'm just waiting to hear about whether they're going to review the files and then give some advice on what to do, because this is very much like a woman's health issue. And I know that Dr. Kazan specialises in endometriosis, so he is a women's health specialist, but endometriosis is when cells grow in different parts of the body as opposed to just the uterus. But this is more related to immunology. I don't know if he's a specialist also in like infection control. I don't know.
There's an outpatient appointment on the 27th of July,
Okay,
booked already.
okay, that's fine.
Alright,
Who's that with? Sorry, who's that with?
Urogynae.
Okay. Because that's not quite what I asked for, and that's not quite what I've been advised to ask for by the clinicians. So what I haven't asked for an outpatient appointment because I've been here for 4 nights. So what Nick Parkinson, the scientific director, and Victoria from the Women's Health Company, they're both qualified clinicians in women's health. They've both said if you've been here 4 nights, and if you've had ultrasound scans, and if you've been in a bed for 4 nights, there's reason for you to be here. You need to request for the on-site urogynecologist or the on-site gynecologist to give their clinical opinion whilst I'm here as an inpatient.
Okay, I'll speak to the doctor again.
Thank you. So what's happening now is they're saying that there's an outpatient appointment booked for me at the end of July, which is obviously no good because I've been in A&E for 4 nights. You know, I've been suffering with really bad symptoms, and the only thing that's masking them at the moment is pain relief. So I need it to be inpatient treatment, which is why I'm here. I've been admitted for a reason because of the severity of my symptoms, and I can't wait another 6 weeks for that appointment. So I've requested for the on-site urogynecologist and gynecologist to review the files on-site, and I'll just have to keep requesting that and then wait to hear back about which antibiotics they're prescribing me now they've stopped the pivmecillin, because I was just on a 6 weeks course of pivmecillin. So I need to get on a different one and make sure I don't have an adverse reaction to that before they can discharge me, because I wouldn't have been prescribed 6 weeks of a heavy duty antibiotic by Dr. Paul if I didn't have a severe infection. I don't think anyway, so I think that's the first step. But I do think that if they're going to be prescribing an antibiotic, it makes sense to consult with the Urogynae team, so that when I'm discharged, like,
they've dealt with the reason why I was admitted and to begin with. So yeah, I'll just have to wait to see what the nurse says when she comes back, and hopefully they'll have some positive updates on what's going on. And in actual fact, I would quite like to speak to Dr. Paul, because it seems strange that there's been this sudden handover from Dr. Paul, who's been in charge of my care for the last 3 days and has got all the details and has seen the reasons why I was admitted and has prescribed me this antibiotic. I'm just quite surprised that suddenly Dr. Kazan has stepped in, because Dr. Paul was my consultant, and I'd like to speak to him about this reaction I've had, because he's the specialist and he's in his like 70s, so he's a lot more experienced. So I think I'm going to ask for Dr. Paul to come back and speak to me about the 6-week course of pivmecillinam which he prescribed, because I think it was working, but it's just I had that reaction to it, and there could have been things they could have done, like keep it alongside with antihistamines, and then I could have continued on that. As long as the reaction I was having wasn't dangerous, then I could have just continued on it with the antihistamines. So yeah, I'm just going to ask to speak to Dr. Paul and get to the root of this, because it's quite it's quite discombobulating when you've had the same consultant for 3 days, you've grown to trust them, and then suddenly they've disappeared and you don't know why, and it's a different consultant who's stepped in, who doesn't have all the details and who is having a completely different approach with a completely different clinical opinion, hasn't mentioned cystitis cystica at all. And now the referral that Dr. Paul thought it was that agreed to make to Urogynae, I don't know, Dr. Paul was in charge of that referral, so I think there needs to be continuity of care when it comes to this, because I've been here for quite a while now and my symptoms haven't really got any better, because I haven't really received any consistent treatment. So I think that's what I'm going to do, is I'm going to ask for Dr. Paul to come back. I'll ask if he's in today, and I'll also request for the reasons as to why the consultant has suddenly changed, because I think everyone agrees that continuity of care is usually a good thing with these acute infections. obviously there's some other patients, if you can hear that in the background, other women who are quite dissatisfied with how things are going. And her boyfriend said, you know, if you're going to just have to wait 3 days to be told they can't do anything for you, then why are you still here? And it's just a shame because I felt like with Dr. Paul, I felt like he was like very reassuring and caring and sort of wasn't rushing me along, and I felt like with him he was very much of the approach like, we will not let you be discharged from hospital until the reason why you admitted has been cured, because this is apparently a non-complicated lower urinary tract infection, and it suggests to me that it originates gynecologically. That's not difficult to treat. It's also not difficult to diagnose. It would just be a simple MRI to check for inflammation. And I overheard Dr. Kazan saying earlier that he's just done a CT scan on another patient and they've had it confirmed that that patient has an infection. So they are obviously running the CT scans. But yeah, it's just quite reassuring, as you can hear in the background. It's not just me who's feeling kind of like a bit, you know, and this is affecting the patient's relationships with other people. Like with my mum yesterday, it was very tense because nobody had come to check on like the symptoms I was having with the adverse reaction. It took about 10 hours for me to go and speak to them at 3 in the morning. And I'm a vulnerable patient, you know, and it's not just me who kind of feels this, but it affects your relationships with other people when you're going through this. I feel exactly the same as her.
They will just say, suck it up. Yes, but if I discharge myself and go home in pain, if I admit that, if I do that, they're not going to take me seriously, they're not going to do anything, and I will be in long-term pain.
Hi, are you the urogynecologist?
Oh no, sorry.
Because basically I need to speak to I've been advised by several clinicians that because this is a women's health issue, I really need the clinical opinion of a urogynecologist. So it's Victoria from DAYE, which is a home testing women's health company, and then Nick Parkinson, who's a scientific director. They've both said they think I've got a gynecological infection, and they've both advised me very much to ask for a review from an on-site urogynecologist or gynecologist.
Okay.
And Dr. Paul was my consultant for the last 3 days, and then I'm not quite sure why, but suddenly the consultant has changed. So the whole plan that Dr. Paul had, which I was building quite a lot of trust in him, and he put in the referral for the Urogyne team, and he was understanding where I was coming from, and he's the one who prescribed me the pivmesilinam. And I believe if he'd come back in today to speak to me, as I thought he was, I believe very much that he would have immediately thought of an alternative antibiotic, similar to the pivmesilinam, which I think was working, but that wouldn't have given me the adverse reaction with the chest itching.
Right, okay.
So I'd quite like to speak to Dr. Paul.
Lydia?
Yeah.
Okay, I'm from pharmacy. I'll let the team know. I'm with pharmacy.
Oh,
We were
thank
trying to get
you.
to the bottom of the allergy, the penicillin allergy.
Yes. Oh
Yeah.
yeah, no, I know, because with the penicillin, I have had the combination of coamoxiclav with trimethoprim. Coamoxiclav contains penicillin, but because I was taking it with trimethoprim, which I don't think does contain the penicillin, I wasn't sure if it was the which was causing the reaction of C. diff symptoms.
Okay.
That was about a month ago, and then with this pivmesilinam, because I have like quite a slow brain, I'm suffering from a lot of sleep deprivation, I'm under a lot of stress, so I wasn't really in tune with my body and how it was reacting. It was only when I was trying to sleep until 3 a.m. that I suddenly realised, oh my god, I'm itching all over my chest. And I went to speak to the nurse and they immediately prescribed me antihistamines.
Right.
And then she said to me, but we can probably continue on with it along with the antihistamines.
Yeah.
But then this morning I haven't been given the antibiotics, so that treatment has stopped.
Okay.
And what I would just like is, like, if Dr. Paul is no longer going to be in charge of my care and has transferred over to Dr. Kazan, I'd at least like to hear that from his mouth, because I really don't believe that Dr. Paul would be happy to just leave me with this treatment plan, which is supposed to be 6 weeks of pivmesilinum, and it's now all been stopped. I now have a new consultant. The continuity of care has been stopped. I don't know what's happening with the Urogyne referral.
Right.
I understand what's happening with the MRI, because I know they're still waiting back. I've been informed about that. But in terms of the other two things, it's like, I don't know what's kind of... And then Dr. Kazan sort of said to me, oh, you know, you don't need to be here for 6 weeks. And it's like, it's just kind of made me feel
It
quite...
seems a bit confusing.
It's caused me quite a lot of stress and anxiety that I didn't have yesterday with Dr. Paul. Dr. Paul made me feel like you know, I'm responsible for you. I genuinely have your best interests at heart, and I genuinely want you to be cured from this infection. Whereas I feel like now it's like I've been left in the dark. Dr. Kazan didn't tell me which antibiotic he was prescribing, when the course was going to start. He didn't even mention the referral to Urogynae or Gynae for a clinical opinion from them. And I just feel like, as the patient, I'm kind of just left here without a lot of like key information. I appreciate they're very busy, but I've just been left here with a lot of key information.
We can do one step at a time, just so we get a better clue. So I think pharmacy are getting involved because we're a bit unsure about this penicillin allergy. So I've got a couple of questions to ask, just to get to the bottom of, see what is this an allergy, or if this isn't, and then we can recommend this to the medical team.
Yeah, that's absolutely.
And then they'll
fine.
be able to come up with a better antibiotic.
Yeah, that's
so we'll just start
fine.
with just one question at a time. So this penicillin allergy, do you have, where has this come from?
So in terms of allergy, I have to be so clear. I cannot confirm whether it's an allergy.
Or
all reaction, I can tell you is like the reaction I've had to these antibiotics.
Okay, so when
my father is allergic to penicillin. My father
Okay.
cannot take penicillin. He is completely allergic to it. So that's why I'm aware of the gravity of penicillin allergies.
And what reaction does he have to it? Is in
I can call him and ask him. I'm not exactly sure, but I think he's been admitted to hospital because of an allergy to it. I remember actually visiting in hospital. I think he'd had the reaction to penicillin.
He had treatment for that allergy.
Maybe. I can't be sure. I'd have to call and ask. Yeah.
So when I've seen on your GP record you were given a penicillin back in 2020. Does that ring a bell? And it sounded like, did you have any gastric symptoms?
Honestly, my life was so busy back then. I was working full time. I was just always active, that I did not have the same lifestyle I have now, where I live on my own. I had 5 housemates. I wouldn't have even probably, unless I'd had an anaphylactic shock, you know, like a serious shock reaction, I actually probably wouldn't have even recognised I was having an adverse reaction. It's only now, because I've been living on my own, and it was so apparent that with the combination of coamoxiclav with trimethoprim, I was getting very severe gastrointestinal symptoms.
So the coamoxiclav, when did you have this?
So that was prescribed to me by a doctor called Dr. Malone. Initially, actually no, sorry, it was coamoxiclav, amoxicillin, clindamycin hydrochloride, and metronidazole were 4 antibiotics that were prescribed to me by a UK-based accredited laboratory called Digital Microbiology, and it was Nick Parkinson who wrote this report, and he stressed to me in an email, he's not a doctor, he's only a scientific director, but he has got an expertise in analysing microorganism bacteria data from patients. So those were the 4 antibiotics that he prescribed. I then booked another, this has all been alongside...
He prescribed them, but he's not a doctor.
No, he didn't prescribe them, sorry. So I then went to another appointment with a different doctor who was from an Artemis cystitis clinic on Harley Street in London. Harley Street's like global famous for being world-class healthcare. So that's why I went there. One-off appointment with Dr. Maloney, who was a specialist fellow with a special interest in cystitis. So he specialises in cystitis, and he runs the clinic. And he's the one who prescribed me, and it was a private prescription. He's the one who prescribed me the coamoxiclav alongside the trimethoprim.
Oh, trimethoprim.
Yeah. So that's where I was on. I was on that for a while.
Do you
that
know
was this year.
This
that was
year?
very recently. That was in the last couple of months. Yes.
So you had some coamoxiclav and trimethoprim, and after you took their medicines, what did you experience after?
So I experienced. Within a few days, my symptoms seemed to improve, and then they very much plateaued, and then it affected me quite negatively. So I stopped taking them, because the main reason why I remember now I stopped taking them is because I felt completely wiped out in the morning. I was exhausted. I was about to see my son the next day, my 3.5-year-old, who's staying with grandparents, and I couldn't even lift my head off the pillow. So it was on that Tuesday that I just stopped taking the antibiotics. And then a week and a half went past, and my symptoms.
Sorry, can we just go back to that?
Of course.
So how many? So were you taking the antibiotics? They were fine. Your symptoms were improving. What was the course length on that?
So my symptoms improved after 4 days.
After 4 days.
And then they stopped improving.
Yeah. Did anything else happen within them 4 days that might have also?
Like I say, I got exhausted, and I couldn't lift my head from the pillow. So I was suffering from severe exhaustion and fatigue.
Fatigue. Yeah.
Yeah.
Okay. So we're not sure if that was because of the antibiotics, or it might have been an external.
I don't know for
reaction?
sure,
Okay.
but what I do know is that I obviously stopped them for a reason, because I was like, if I don't stop these now, I'm not going to be able to get to where I need to be tomorrow, which is seeing my son, being with his
Okay.
grandparents, and I was like, I have to stop them. So it was some kind of reaction, but yes, you're correct in saying it could have been a flu.
Okay.
But then this is the key part, and don't ask me why this is, but when I restarted them about a week later, because of the fact that I had no other treatment, I was having no other prescriptions, I didn't know what to do, I was desperate, my symptoms were getting worse. When I restarted it, I was just at home, and I was like, I'm going to just focus on how am I actually reacting to this combination of antibiotics. It was then that I realised how bad the side effects were of like what felt like C. diff.
Okay, C. diff.
Yeah, so like really severe
Extreme
gastrointestinal. Yeah,
diarrhea.
exactly that. Exactly that.
Diet-
Very,
extreme
very
diarrhea.
noticeable. Yeah.
Okay. And were you admitted to hospital because of it, or did it stop when you
I just
stopped?
had to stop taking them.
You just
I had
stopped
to stop
taking
taking them.
So
Yeah.
it's just severe C. diff, and it was because
Yes.
of the co-amoxiclav and the trimethoprim.
Yes. Yes.
Okay. So we don't know exactly if it was the co-amox
Yes,
or if it was
correct.
the trimethoprim. Okay. Right. And so I'm assuming this is an oral. Was it
Yeah,
an oral
it was
tablet?
all- yeah.
Have you ever had any IV or injectable?
haven't, no.
Okay.
So the
it's
only
oral.
clinician who's recommended the IV was again private home testing company who do home tests. Never had an in-person consultation, but this doctor's called Dr. C.S. Anderson. She's a women's health urogyne infection specialist with a specialism in postmenopausal care. That's her tagline, and she's got MSF, all these different qualifications. So she's got my urine sample. They've done a urine broth culture, this company, they're called Focus Laboratories. They did a urine broth culture, and it said Klebsiella pseudomonas enterococcus. That's what came up as the flagged pathogenic bacteria.
Okay.
And then she wrote in her report, first line treatment that I would recommend, with my clinical opinion as a doctor of my area of specialty, it would be an IV drip with a combination of what she listed as were 9 different antibiotics, which did include tobramycin, amikacin, and gentamicin.
Okay. Any penicillins?
Chronic cystitis.
Okay. So not necessarily how your body reacts to them. So that wasn't like an allergen test or
It wasn't an
any
allergen test
reaction.
at all. It was literally a urine test to check for infections. And in order to check for the infections, they're screening for pathogenic bacteria, pathogenic microorganisms. And that's what she suggested, was the IV drip. That was genuinely what she suggested.
Okay. And okay, so just trying to get a clearer picture. So
Yeah.
it's just this severe like C. diff type
Yes.
symptoms is what you're experiencing with the trimethoprim and the comox.
Yes.
Since then, have you had any prescriptions for penicillin? Or
So since then, I've been prescribed pivmecillin. So most recently,
Pivmecillin.
Dr. Paul, 2 days ago, he prescribed me pivmecillin.
okay, so that was on this hospital.
Yes,
Okay.
and I took about 5, maybe even 6 dosages of that, and when I woke up this morning, I felt like my symptoms had improved in terms of bladder fullness, because my main issue is that my bladder's filling up ridiculously quickly. So when I went to the ultrasound yesterday, 5 minutes before that, then the janitor was wheeling me down to the ultrasound. I literally emptied my bladder. Get down, do the ultrasound scan, and she says to me, your bladder's completely full. So it's just filling up really quickly, which
Okay.
never used to happen. So basically, yeah, so that's, in terms of penicillin, all I've been prescribed was pivmecillin. I don't know if that's how you pronounce it exactly,
That's not, yeah.
but that's what Dr. Paul had prescribed me for 6 weeks.
Okay.
I really tried to tolerate it. I was with my mother yesterday, I felt awful, I could feel
what
the
are these-
itching, but I tried to
itching?
tolerate it, and it was only at 3 a.m. when I'd slept for the previous 3 nights here. Very noticeable, I was feeling very different, wasn't able to sleep. But I could have dealt with that. I probably wouldn't have said anything. I'm the sort who doesn't complain, and I just tolerate things. You can ask my mother, honestly. But it was to the point where my chest was itching so much, and you
that
can
was
see the
just
marks on
on-
it. That
Just when you were taking, that was the only
Yes.
thing you were taking, so your
Yes.
itchiness as well.
So what I've been taking since I arrived is methenamine hypurate, and obviously the codeine, the ibuprofen, the paracetamol, and
Are
then
they your regular
the
medicines?
pivmecillin.
And you've not had any bad reactions to them? Are they your regular? The codeine
Yeah,
medicines?
correct. So the reason I thought it was the pivmecillin is that methenamine hypurate, I've never had the itchiness of that, and I've been taking that for months.
Yeah.
The codeine and the paracetamol and the ibuprofen, I was being given all of that in the admissions lounge, and I didn't get any itchiness. The itchiness
Okay,
just
so it
literally
does sound
started
like-
yesterday. Yeah,
Okay, so it's severe itching on the chest,
I'm just literally localized to the sternum,
sternum. Okay,
Yeah.
right.
which is such a shame. But then they gave me antihistamines, and the nurse last night said, we may continue on you on this penicillin, but to take it alongside with antihistamines.
Mhm.
But then for some reason today I haven't spoken to Dr. Paul. I don't know where he's
Okay.
gone. He hasn't spoken to me, which is quite unusual because like he was very much in charge of the treatment plan, and
Okay.
he's in his 60s. He's extremely experienced, and he's a retired cancer specialist. So
Okay.
you know, I just feel like he would have such a good knowledge of what's going on, and he really seemed to understand what was going on.
Okay. I'll let the team know. I don't have an exact contact with him. Because I'm
Right,
quite
yeah.
So we're trying to just focus on the
Yes.
penicillin. So
Yeah.
this chest was
Yes.
it like fluid filled?
No, it was literally here on my sternum, just itching like this.
Itchy.
Like
So is it-
literally on my sternum, in my breastbone.
Was it raised?
No, it's just like got like white, like red bumps now.
Red bumps.
Yeah, red
okay.
bumps.
Bumps, itchy, like hives.
Yes,
Did you say
it felt like
hives?
hives. That's exactly what it
Hives.
felt like. Yeah.
Okay. And it does sound like after you've taken it,
Yeah.
this is what's happening.
I mean, I was desperate to stay on it. I wanted to be here for over the weekend, Monday morning. I asked to stop the pain relief to see if the symptoms have stopped. I'm all better, and I leave and then can be discharged from urology. Like, I don't want to be, I would not honestly be like taking up the time of doctors taking up a bed if I genuinely didn't feel like I just really want this to be cured. So I hope I've made that really apparent to the doctors that I know my body, and I'm not making these symptoms up. You know, I'm having to advocate for myself. I don't have like my husband here, or I don't have, you know, a sister here with me or my brother here with me to help advocate for me. So I am, it is quite draining, quite exhausting. I've been having these symptoms for over a year. I've got a lot of other stresses, and I am advocating all for myself here. And I'm already the vulnerable one suffering from long-term health conditions and this acute infection. So, you know, I'm doing my best, but you know, I am only human. I am only human, and it is difficult sometimes. But I am really trying to do my best to like communicate my symptoms openly and honestly, and work with the doctors, not against them, and you know, be as malleable as I can be to what they're you know prescribing. You know, I'm not saying no to any prescriptions. I'm just when it's really clear that I'm having some kind of adverse reaction, I can't not speak up.
Yeah, no, that's why we're here to try and find out. And it does sound like because this is the new medicine, and these are a new onset of symptoms.
Yeah.
Did you get this hives rash when you had the co-amoxiclav? No, it was just the
I've
colitis.
never had it before.
Yeah.
I've never had that particular
Okay.
side effect before. Yeah.
Okay, and so that was the only new medicine. Any foods? Have you had any new foods in particular? Okay, and then when was your last dose? When did you last have?
Last night.
Last
10 p.m.
night.
Yeah.
And then you've not had it today, and you've not had any flare-ups.
No, I haven't. No.
Okay. So this is the first time you've had the rash.
Yeah.
So it sounds like you've continued on to try and push through the symptoms.
Yes.
Okay.
I have really tried yesterday. I'd say it was probably 7 to 8 hours where I could tell I was experiencing something. I was burning up, sweating profusely, feeling like I was in the middle of like a sauna, not just a hot day. And like,
Yeah.
for example, the reason I say that is because today it's still the same temperature outside. I don't feel like I'm burning up, and I don't feel as like stiflingly hot, and I'm not itching. You know, so yesterday I think I was having like some kind of allergic reaction or adverse reaction to whatever was in the drug.
Okay. And when you had the antihistamines, did that ease the itching?
It did ease it enough for me to fall asleep. I had 2 codeine, I had the antihistamines, and I managed to fall asleep. But without those antihistamines, I would not have.
Okay, so the itching is relieved with the antihistamines.
Yes, correct. Yes.
Antihistamines.
Yeah.
So if they were to continue on with the would you think the reaction is in? Would you be happy to continue on with that antibiotic with the itching, but help controlled with the antihistamines? If that makes sense. So
Yeah.
would you be able to continue on with the antibiotics with the antihistamines to help with the
So
itching?
what I'd like to know is, yeah, the answer to that is absolutely yes with the
Okay.
antihistamines. However, what I want to make sure of is that, you know, sometimes with adverse reactions, it can actually be like damaging your body. So sometimes, for example, you can get involuntary muscle spasms, which can be cause long-term damage to your body. So I want to just make sure of is what was that reaction that I was having? You know, that hives rash. If I were to mask that with the antihistamines, would that cause me damage, or is it just a benign kind of side effect that just so happens to be uncomfortable?
Usually hives is I don't know, like the science is it's what's called histamines. It's that itchiness. So if you've experienced hay fever, it's usually local, and it's usually just because of that. And it does sound like hives. So and the antihistamine stops that itching, so you won't be scratching it, so it won't be damaging that skin, if I'm saying that correctly.
It does make sense. I mean, ideally what I'd like now at this stage is to speak to Dr. Paul again. And also for him, because he was the one who agreed to this, for him to speak to urogynae, because this is a urogynecological infection. This is not just a urological infection or kidney disease. It doesn't look that way. From the clinicians who I've spoken to, from the test results, from the proteinuria, from the high ALT, it looks like this is a urogynae infection. So what would be ideal, I think, is to restart those antibiotics in the meantime with the antihistamine whilst I'm waiting, so that I'm not just sitting here not getting any treatment, when potentially carry on with that for another day, I might be all clear. But also for the urogynae to consult with Dr. Paul, who is the one who understands about why he prescribed the penicillin, because I don't think Dr. Kazan would have prescribed it. That's the problem. He's got, and I totally respect it, but he's got a completely different clinical opinion on what I'm experiencing. And like the treatment that was started was by Dr. Paul. So I just think that if he could consult with urogynae, he would really be able to come up with a, you know, the right, now he's got this information about the hives, he can kind of now respond to that. A broader picture.
So just what we're going to do now, I'm going to document this, the fact that you have to continue with the antibiotics and you want to speak to Dr. Paul. I can't promise. I'll contact the urology team and see if you can. So it does sound like it's an adverse reaction as opposed to an allergy, because it seems to have been different.
I think so.
And it's been managed with the antihistamines.
It was last night.
It
was last
night.
You've
not had another dose today.
I haven't had another dose today. I mean, we could give it a go. You know, I could give it a go alongside the antihistamines. Maybe I'll feel nothing. You know, maybe it will be completely tolerable. In which case, can just continue on with it that way. Or maybe it will still be itchy, or I'll say, oh, it feels like I'm still burning up, but it might be absolutely fine. I'd rather give it another go in the meantime whilst waiting for the urogynae clinical opinion, because I do really think that's important. And I know they usually do have, if not a urogynae specialist on site, they will have a gynecologist, especially because there's gynecological emergencies all the time and stuff. So I know they'll be busy, and I don't mind waiting, and I appreciate it will take some time, and I'm not trying to rush them, but I just think that given I've been here for 4 days, it makes sense to get this case closed, you know?
I think what
I'm not taking up any more NHS money and resources to get the case closed.
What we were the most concerned about is if having on your record a penicillin allergy massively reduces the amount of treatment options open to you. So it's, if we can manage it with this, but that treatment will still be effective.
Absolutely.
This won't be a barrier towards
completely.
treatment.
I understand that it is. I wish. Is there a test for a penicillin allergy? Is there a test for that?
So there's allergen tests. It's a bit what we class as an allergy is something that you need treatment for. Something like, have you heard of the condition Stephen Johnson? So it's when you need treatment in order to, so the harm of giving you the antibiotic outweighs its effect on you. So if it's because it's unfortunate, it's a bad reaction. However, if we can manage that,
totally
you'll be able to.
Like if I'm still able to get a few hours sleep, and if I'm not having that, if I'm not having that horrendous itching, like the high temperature, that's fine. Because if I know that whilst experiencing some minor side effect, it's like really killing the bacteria, it's really getting in there and like curing this bladder infection, and every morning I wake up, suddenly in 2 days my bladder's not full, I wake up and I'm like, I'm right as rain, let's get me out there. I'm more than willing to tolerate side effects, or at least see how it goes. I'm really I can't emphasize enough that I am really trying to work with the medicine,
Yeah,
and I'm
of
trying to
course,
work
yeah.
with the doctors, and I want me out there as much as anyone
Yeah,
else does.
yeah.
So
Understood.
I just know that, like, if I go home and I carry on with the symptoms I was having, it will be another crisis, and then these 4 days would have been completely wasted. You know, I'm going to change my lifestyle when I get out of here. I'm not going to go swimming anymore, you know, and I'm going to make sure that I have already upped my hygiene. I'm going to really go for it with like the high preps of the methenamine, high purate with the ascorbic acid, take all the supplements I can so this does not happen again. But I just really, now I've been here 4 days, I just want to make sure that I'm not going to be readmitted in a week, you know, that this is dealt with, and I know I leave here and what's making me think that is Dr. Paul's a cancer specialist, and he's put down, I know because I read it, he's put down that he thinks this is an uncomplicated lower urinary tract infection. That's what he thinks. He's probably right, but I think what's exacerbating it is the fact that it's also a vaginal infection. That's what Nick Parkinson has said in his email, and that's what the DAYE company test results came back as. So that's the problem, is that yes, it's a lower urinary tract infection, uncomplicated, which is very easy to treat, but you have to deal with the root cause of it, otherwise it's going to keep spilling over, and it's going to keep the infection's never going to go away if the root cause isn't addressed.
Yeah.
But like it should be that I should be in and out, you know, because if it's just a not uncomplicated lower urinary tract infection, then it should be very easy to just notice quickly, like stop the pain relief for a day, and then be able to say, I don't have the symptoms anymore. I'm not having to rush to the bathroom every 2 minutes, and then it's cured. You know, it's cured, and I'm discharged, and that's the end of the case.
Yeah, that sounds like something. Yeah, obviously you need to have the doctor to discuss. We're more focused on like barriers of treatment, because usually you'd have a urine. We go to micro. We'd be like, which antibiotics are sensitive, and if one of them's penicillin, we'll be like, well, perfect.
Yeah.
We can treat you with this. So we're just opening up. So now we'll be more open to antibiotics.
Yeah, I mean, if because I've just spoken to, it's just a bit discombobulated because I've had 2 consultants, but I appreciate like that there's probably been an emergency that Dr. Paul's dealing with a cancer patient. I'm not going to stop that, but I don't know. It would be interesting because I've just had this consultation with Dr. Kazan. He didn't say to me, here's a similar antibiotic to the one that's with the penicillin that you've just been prescribed, which is similar to pivmecillin in the same group, but which we can maybe give you, which is basically the same, but won't give you this adverse hives reaction. He didn't give me the name of that antibiotic. So if he has a suggestion, I would also be willing to try that. I could maybe even try both at the same time. I don't know because I'm not the doctor.
No, yeah.
But it's like what we've spoken about is like, which I'm agreeable with, you know, is getting back on the pivmecillin and with the antihistamine. But then what I've just spoken about with Dr. Kazan is maybe being prescribed something similar but different.
Yeah, I think because he saw the penicillin allergy and was like, maybe let's avoid penicillin allergy if it is an allergy. Again, I've not had that discussion with the team, but we're more, So I think.
But based on me having told you that I felt like the pivmecillin was helping, I think that's why you've suggested, and you're a woman as well, so you kind of understand like women's health issues more and what it feels like to have cystitis, and you probably experienced.
I'm not a clinical,
I mean? So,
I'm not a doctor.
I know, but it's like it's hard for a man to envisage what it feels like. You know, it's debilitating cystitis. I've had it for over a year, but so you kind of understand like sometimes the minor side effects is worth it if you know it's working. And if you've already just been on it and you feel like it's working, it might be worth carrying on with it, because I don't know what the delay will be to getting this new prescription. And like, I'd rather be receiving treatment now so that you can get me out of here as soon as possible, rather than be waiting and then this new one might not work as well. Like, you know, you just don't know. So I mean, I've consented to like starting up again with the antihistamine, but I already said I'd be happy to do that today in the morning anyway. I thought the pill they brought me was the pivmecillin with the antihistamine, so it was their decision. They decided that they weren't going to keep prescribing it, and there's nothing I can do about that, you know. So it's up to you doctors to make a decision.
Yeah, we'll discuss that with that, but it looks like we've broadened the spectrum of drugs that we can use to treat you, which was the aim of this consultation.
Yeah, I'm glad that you've got all the answers to the questions you needed to.
Yeah, no, thank you so much. It seems like it's frustrating, I understand, and we're all working together. So
I think that according to this Dr. Malone, who's a specialist in cystitis, because what I'm thinking is that having been on these antibiotics, and if I'm going to be on them for a few more days, it might, because I haven't done any retests, That's what I'm a bit worried about. So like I had one blood test when I arrived on the day I arrived, which was 4 nights ago, and I gave him one urine sample on the day I arrived, which was 4 nights ago, and I haven't had any retest since then.
Okay.
So in terms of like monitoring whether the infection has got better since being on the pivmecillin,
Yeah. Have
I
you
feel
had
like
bloods?
monitoring like epithelial cells, according to Dr. Maloney, like my epithelial cells were 14, and monitoring whether they decreased in a sample might show you whether the
It's less
antibiotics are
about
working.
volume, it's more about if we're detecting certain microorganisms and the antibiotic would treat that microorganism with like,
okay.
yeah, so it's more about sensitivities because there's some bacteria that's resistant to antibiotics. There's no point in us treating you with an antibiotic that's not going to work.
Yeah.
But
Would
it
it worth
also-
me doing any more tests at all, like giving in any more like urine samples or
think this-
even like swabs to check for bacteria that might be in the throat, like throat swabs, you know, for.
I think I'm assuming. I thought you said you had a urine sample.
So the only sample I've sent off since the 4 days ago when I arrived, I just sent off an extended vaginal swab to Focus Laboratories, and that's going to screen for all manner of microorganisms in the vagina, which I've never done before. I've only ever done that from a urological perspective. And then having received the clinician's opinion that this may be originating in the vagina, I've now sent off that swab. But those results won't come back for, I think it's up to 7 days, because it's a private company.
Yeah,
the test
they
cost
don't
me
liaise.
£95. But it's kind of just because I'm trying to do as much as I'm trying to do my part as much as I can so that I can
Yeah, the thing
resolve
with
this
private
as
is
quickly as possible.
it's harder to communicate with the two. Within the NHS, we were able to
Yeah.
contact your GP. We're able. It's harder because we
Yeah,
have to
of
rely
course.
on
I know.
your information.
But that's why I was
Yeah.
thinking if I thought that I could request and maybe do that extended swab in the NHS, so you'd have those results quicker than the private company.
Yeah, I don't
would,
know what
but
the difference is between what the private company do, but we do.
It's just
swab,
testing
yeah.
for pathogenic microorganisms. That's all they do.
Okay.
It's just testing for things like Klebsiella, Enterococcus, Pseudomonas, like the standard harmful pathogenic bacteria, which usually are related to UTI symptoms. That's all they do. They just test for pathogenic bacteria that's commonly causes symptoms. So if there's any test that you could do here that might shed more light on what's causing the issue, then
Yeah, I think if you've had ones already, it does take a while for like micro to get back. But I'm not completely.
They
clear of the
tested, tested for chlamydia, gonorrhea, mycoplasma. Like they did an STI screening. Like
That's usually included within. It's
but
just,
they only did that though. They only did that, and like I haven't had a partner in years. Like this is not sexual disease. This is not sexually transmitted infection. I've been single for 2.5 years. It's got nothing to do with that. This is related to like picking up pathogenic bacteria
They do
years
this just
ago,
to,
and it's
just
been
to
dormant for
focus
years.
and just to cross things out because
And in terms of Enterococcus, which Nick Parkinson has said is causing my symptoms, I personally haven't seen it. I haven't seen anywhere. It may have been done, but I haven't seen anywhere on the system or in any documents that I have been tested for Enterococcus on the NHS. Like I haven't had any indication that the labs on the NHS have tested for Enterococcus, and I've had it confirmed by Dr. Paul yesterday, and by Nick Parkinson, the microbiologist, and by Dr. C.S. Anderson, that Enterococcus is definitely prevalent at a high level, and that they think that that's what's causing the symptoms. So if there was be any way of testing for that here, then that might then confirm that I have the Enterococcus at what CFUs it's at, and then you'd be able to prescribe the right drug to get rid of it, and then it might be that it's all resolved.
Yeah. I think again that's more for the medical team to do their diagnosis screenings. But because we're more about treatment selection. Sorry, I just don't want to give you any information that's incorrect.
No, I know, but
so,
you're about treatment selection. But if you
Yeah.
don't have the diagnosis, then how can you treat it? That's the problem.
Yeah.
It's going to be a case of like again just medical trials, medical trials and clinical trials, which I guess is kind of standard guidelines to keep doing these clinical trials on me over and over again, and it's fine, and I'm doing it. But all I can say is that it would probably be, and I think it's quite uncontroversial to say that it would probably be more effective medical treatment if it wasn't just a clinical trial, if it was actually targeted treatment for a targeted diagnosis.
Yeah, I'll check on because I haven't had like a full clinical review. I was just come in here just to come to the bottom of the allergy.
Yeah.
So I'll see like a bit more of a clearer medical picture, and we'll work together with the med team to select the right medicine for you. But
yeah, that's fine. I mean, like I say, I'm working with you all, and I'm grateful to even be
understand.
receiving medical care. And I'm not trying to be difficult.
No.
If I could have tolerated that penicillin, heaven above, I would still be on it.
Yeah.
I really would. I would still be on it right now, and I wouldn't have gone and spoken to them. I tried not to, you know, because I know that this has created an additional difficulty, you know, which I didn't want, but I can't control how my body responds to these drugs.
It's about communication and
communication, and I'm just trying to communicate, you know, and I am being patient, you know, I'm just here waiting, and I'm not, I'm just trying to make sure that, you know, I'm not doing everything I can to get myself out of here as quickly as possible, and be given the all clear and for the symptoms to stop, and then I can get back to my life and, you know, not have to be discharged from urology, be discharged from urogynecology and just move on. You know, but at the moment I can't, because I just haven't had any, I've had literally 5 pills since I've been here, and I just don't know if that's made a difference, because I'm on so much pain relief that I can't tell you for sure what my symptoms are at resting are, you know, so it's just difficult.
Okay, I understand. Yeah. But thank you so much for talking with me. It's been very insightful. But thank you so much.
I hope I've answered all your questions.
No, of course, that's all my list. But thank you very much, and hopefully we'll get to the bottom of it.
I hope so.
Yeah.
Hope so.
Okay,
Fingers
take
crossed. Thank you. Bye.
You're welcome. Yeah.